Assalamu alaikum, dear students. Hope all of you are fine. Today we are going to discuss the third chapter of bioscience, that is, why do we fall ill? Come back to our first slide. Health. All of us are aware of the fact what health is. In simple terms, we call health the state of physical, mental and social well-being of an individual, or we can say health is a combination of three components: physical, mental and social well-being of an individual. When we talk of physical, it is the physique of an individual, or we can say he should possess complete physical fitness, absence of any abnormality in physical organs or physical structure. Or this physical also means physical environment. There should be good physical environment, clean surroundings and good sanitation. Coming back to our second component of health, that is mental. When we talk of mental health, it means that a person should be free from stress, anxiety and depressions. And when we talk of third one, social well-being, it is social environment, how a person reacts and interacts with the society or the other members of the society, that is called friends, family members. For a social environment, social equality and harmony is necessary for good social environment. Coming back to our second slide, that are the features which are important for maintaining a good health, that is free from sickness and disease. He should be free from any types of diseases. He should not possess any type of social and psychological tensions. He should be free from these type of tensions which is concerned with the mental health, and he should feel every moment of life joyfully. Coming back to third slide, we can say in a nutshell that these are the factors which affect the health, that is food and diet, exercise, family, friends, stress management. All have to be maintained in such a way that a person's health will not be affected or deteriorated. Coming back to fourth slide, that is now disease and its causes. When we talk of disease, it is a combination of two words: dis-ease. Dis-ease means when you are not feeling comfortable, or when normal functioning of body changes to worse, which can be diagnosed with symptoms or signs by the doctor. Coming forward, there are types of diseases. 4 types: acute, chronic, infectious or communicable, non-infectious and non-communicable diseases. Coming back to our slide, that is acute. Acute means brief or severe, or we can say acute diseases are those which last for a short period of time, for a few days to a week, and does not have a long-term effect on our health. Common examples are common cold, fever, headache, cough. These are those diseases which whose life time is very short. Coming back to forward, chronic are those diseases which last for a long time and have a very long-term effect on our health. These include cancer, elephantitis, mainly caused in our limbs by the worms, diabetes. Now, infectious or communicable. Communicable means those which can be separated from an infected person to a healthy person through carriers like air, water, food, contact, vectors. All of these are the carriers of these communicable diseases. We can give a simple example: common cold, which can separate from an infected person to a normal person. These can be prevented by providing clean surroundings, clean drinking water, and food that should be also clean. And we should not allow the water stored at any place, due to which these vectors could not breed. After that is non-infectious or non-communicable disease, those which does not suffer from an infected person to a normal person. Like we can take example of blood pressure, diabetes, cancer. These does not separate. Moving back to our 10th slide, that is causes of disease. Now, what are these causes of disease? The main cause of disease are the microorganisms like fungi, virus, bacteria, protozoa, and sometimes worms. And the main cause are listed below: genetic disorders, which is caused mostly genetic disorders mostly from the birth, or we can say these diseases may be due to mutation in one of the genes in the body. Environmental pollution, air, water, soil, any type of pollution can affect it and may be the cause of the disease. Malfunctioning of body parts, when our one of the body part does not function properly, we can say there is something which is not in a good which is not in a good position to do its work. And we can say malfunctioning of body, we can also say that when our body, when we talk of malfunctioning of the body, when sometimes when we are our functioning of the body changes to worse, we can say that is the malfunction of the body. Poor health and undernourished, when the health conditions are not good, or hygienic conditions are not good, or the food you are taking are not does not give you enough nutrients which are essential for maintaining a good health. Lastly, these diseases can be also be prevented by the vaccination, or we can say in simpler, prevention is better than cure. Thank you.